Okay, we're going to finally start actually looking at the actual muscles of the skeleton. So some of the main ones, and these ones would have been on your origin insertion sheet. Muscles are named according to certain reasons. Size, part of it deals with their size. Shape, location, action, what they do. Number of attachments like biceps, triceps, direction of its fibers, or any combination of the above. So pectoralis major deals with size, major, and pectoralis deals with the area that it's found in. Deltoid deals with the shape. It has a deltoid, that's actually the shape of it. Extensor digitorum is going to extend my digits, so that deals with the action, extensor. Biceps brachii, the number of attachments, 2. And location, brachii you'll find deals with arm. So brachii, brachioradialis, brachii deals with arm. Sternocleidomastoid tells where it attaches. So it's going to attach to your sternum. It's going to attach to cleido, part of your clavicle, and mastoid process that was back up here. So that deals with where it attaches. External oblique. External, your obliques are on your stomach. External means it's the outside layer. And oblique means that it's going to run sideways, it's not going to run up and down. So those are a few examples of how muscles are named. And I'm not going to read through all of these today, but this is a picture that you should know all the muscles that are on here. And what we will do is take it and break it apart. So like today, we'll look more a little bit at the face and neck and that area, and then we'll look at the upper body, we'll look at the lower body. But by the time that we are done, you should know all the muscles that are on this picture. So if you want to X this one, that would be one that you should know all of, as well as this one. This is just the posterior side. And some of them, if you lift weights at all, some of these will kind of make sense, like pecs. When you're working your pecs, you're working your lats. That would be like your latissimus dorsi. Your glutes is more of your bottom butt region. I guess when we talk about our legs, we talk about hamstrings and quadriceps. We actually we'll break those into individual muscles when we get to the legs. So today we're going to start specifically with the muscles in your face and your neck. So muscles of facial expression. How many of you have heard the saying, it takes fewer muscles to smile than to frown? That is a correct statement. And you can, if you actually try to pull your outside of your lips down, it's not easy to do. It's much easier to smile. So muscles of facial expression attach to underlying bones, your facial bones, and connective tissue. And so all of the facial expressions that you make deal with the muscles that are in your face. Some, like I cannot do where you lift the one eyebrow, you know, and some people can do that where they lift the one eyebrow and not the other.
There's Garrett and Michael Mann who can do stuff with their unibrow that I don't even want to talk
Yeah,
about.
some people have, and I don't know if it's different control or just the way the muscles are, but everyone's muscular facial expression is not the same. Major muscles will include your epicranius, orbicularis oculi. Orbicularis deals with circular. So oculi is going to deal with your eyes, circular muscle around your eyes. Orbicularis oris is going to be around your mouth. Buccinator, often called your spitting muscle. Zygomaticus is your smiling muscle, and platysma is kind of your frowning muscle. So if we look at those, the epicranius is one large muscle that we actually break into two parts. So I might ask, frontalis is the muscle that I probably talk about the most, and that's what you use to raise your eyebrows. So when your frontalis contracts, it pulls your eyebrows forward. Occipitalis is towards the back, and it doesn't, I don't want to say it's not used as much, you don't feel it in your head as much when it works. And notice there's an aponeurosis that connects those together. So of these two, the frontalis is the one we'll talk about the most, but both of them make up the epicranius. Orbicularis oculi is the one that's around your eye. It helps you to close your eye. It's circular. Zygomaticus, right here. So I know somebody asked on the origin insertion. There is the zygomaticus major, which would be this longer one, and the minor. And they work together. So when they contract and pull up, what do? Smile. So when you smile, and it's funny, during the muscle test, I will see you guys lifting and moving and smiling, and because you can actually, this is something you can sit there and do. So if I want to contract my zygomaticus, you're going to smile, and then you can actually feel that muscle contract. Buccinator is one that lies further underneath, and when you forcefully spit or blow air out your mouth, something, that's the muscle that you would be using underneath there. Orbicularis oris is around the mouth, and that would be your, you could call it your kissing, puckering muscle. Masseter. Masseter is your huge muscle. So my masseter, when I coach and I get crabby and I'm not actually yelling, I will like clench my teeth terrible. So if you clench your teeth, you can feel that muscle tighten right here. It is a large muscle in your face. The masseter closes your mouth, it clenches your teeth. Sternocleidomastoid runs down the center, or the side, and it's going to pull, so when you bring your head down kind of to the side, or to this side, there's a sternocleidomastoid that's going to come down on this side and the other side, so it brings your head down. Trapezius, more, we'll talk about that actually more on the back. And platysma is a large muscle that you don't specifically use by itself. If you go like this and you see that, you can see the muscle right, it's really a very ugly look. But when you pull your lips down, your platysma is the large muscle that does that. So those muscles, I would say, yes, you are responsible for knowing those. Here, it tells you where it inserts, it tells you its action, what it does. So notice your orbicularis, both of them are more for closing. They are circular and they bring things together. Mastication, big word for eating, basically. So muscles of mastication, chewing movements include an up and down motion. So in order to chew, you have to move your jaw up and down, as well as some side to side, especially if you're chewing something off to the side. Chewing muscles are basically your masseter, that big one that I said that closes your mouth. And then your temporalis, that you can actually feel temples in the temporal region. So there again, if you clench your teeth, you can feel your temporalis move also. So those are the two main muscles that are going to bring your mouth up. Elevates and protracts, which brings it forward. Elevates, retracts, it's going to bring it backwards a little bit more. Movement of the head, so if we want to bring it forward, move it backwards, around, things like that. Sternocleidomastoid, like I said, that one you should know. The splenius capitis and spinalis capitis, probably not as important. There are a lot of muscles that you can look at in the back, and we will not memorize all of them. But so you can see, when we start looking at the back muscles, they are going to attach to your vertebrae, and look at all of the different attachments. So semispinalis capitis would be this muscle here. Splenius capitis sits on top of it. So it's going to be on the outside. It's going to bring your head back a little bit more, where the semispinalis capitis brings your head more straight back. So any muscles that are found along your vertebrae are going to pull your head backwards. Where the opposite, the sternocleidomastoid, is located on the front, it's going to bring your head forward and to the side. And I'm going to stop there for today. We'll talk about the pectoral, we'll start getting into the chest and the arms next time. So for today, we'll stick with the face, the head, and the neck.